If you're noticing your jawline is not looking defined, all of a sudden you're seeing these jowls, let's talk about what we can do for it without surgery. I'm Ginille, a cosmetic nurse practitioner since 2013. I went to Stanford, I went to Duke. I own Jawsy Skin and Wellness. You can find us in Los Angeles and Las Vegas. Every day we focus on natural looking aesthetic results, safe for all skin types and tones. So I'm here today to go through all your questions, and now back to the jowls. So over time, people will notice their jawline is looking saggy. Fat pad keeps sinking, jowls appear here, our chin starts to set back, and when the jawline doesn't look defined, people just don't feel like they look as youthful. So without surgery, here's some considerations. What we can do is filler or the natural filler in front of the jowl fat pad here, possibly also behind. We might do some into the chin as well. We don't want to just straighten this out and have a short chin, or else your face will look wide. We may do some Botox into the Platysmal bands, our neck bands. So this muscle here, when we Botox it, it's going to help tighten and define along the jawline. And then we can also consider doing Kybella. This is a permanent fat dissolver that we can inject into the fat pad to get rid of those fat cells. So doing a combination of all three of these, or one or two, can really help give nice looking aesthetic results along the jawline, making things look sharper and more defined. Okay, if you have any questions, we can talk through any of them here and now. I'm so happy you're here. I love to do the lives. I love helping you make informed decisions about cosmetic treatments. Everything we do in our office is non-surgical, and again, safe for all skin types and all skin tones. I will go through the most commonly asked questions I hear on a daily basis, and we can talk through everything. So in our office, one of the primary things we do, patients love coming in and they like having this natural filler. So what is this? PRF EZ Gel. This is a filler alternative made entirely from your body's own growth factors and stem cells. What we do is a simple blood draw in the office. When we take your blood draw, we spin it in the centrifuge. It's going to separate out your platelet-rich fibrin and your platelet-rich plasma. This has growth factors, stem cells. That's all the liquid gold we want to use. We take that part, we heat it and cool it, and so it forms into a gel. We can inject that anywhere in your face, and wherever we inject it, your body's going to make new collagen over time. So collagen is what helps keep the skin look youthful, bouncy. We start losing collagen mid-20s and we keep losing collagen. And so all of a sudden people feel like their face doesn't look as lifted, the skin doesn't look as healthy. So this is a natural way to produce new collagen made entirely from you. I will say younger and healthier patients have better outcomes. You know, once we start getting in mid-60s, it gets a little bit harder for the body to produce new collagen. Also, depending on your lifestyle, the healthier you are, again, the better. So drinking, smoking, drugs, we want to be mindful of all that, because we need to create a really good environment for your body to make new collagen. New collagen does not happen overnight, so this is not an instant effect. A lot of people say, oh, I did it and it only lasted 2 weeks. I'm like, no, your provider didn't talk to you about this enough. It's not lasting 2 weeks. What you saw the first 2 weeks was likely swelling. That swelling goes down and may look like you didn't do much, but it is your body gradually producing that collagen. So it can be 4 months, it can be up to 6 months for your body to create collagen for you to see the full results. And I will say, even for patients, we have a minimum of 2 sessions when we do it. Even, some come back after 1 and they're like, I can already see this. I'm so excited. Usually they're the younger ones. Some in their mid-40s are like, I didn't really see anything yet. I'm like, okay, give it time. They always come back. They always come back to do it again for their maintenance around a year later. I'm like, oh, you're back. I thought you weren't seeing much. And they're like, I did. It was 4 months later. It was 6 months later. I noticed I didn't look so hollow under my eyes, or the lines didn't look as deep. Everything just looked a little bit better. So I'm like, that's what I expect. It's going to improve over time. But again, the healthier you are, the better the outcome. And then people will ask, how long does it last? So new collagen is going to last depending on how well your body is maintained. It can last for up to a couple years. Still, you're going to want to do your maintenance around a year out, because we're going to keep losing collagen and we want to, continue to stimulate it. healthier you are, the better the outcome. So you want to keep that one in mind. I love it. I've been doing it all over my entire face the past couple of years. I've done it in my under eyes, my smile lines, my temples, my cheeks, my chin, the corners, short shadows of my mouth. I will totally do another session. I feel like I'm due. I just got to get a teammate to help me out. But I like that one. When I first did it, I feel like I was like patients where they're like, I don't see any change. Over time, I was like, dang, I don't look so haggard. So I haven't had any traditional filler for over 3 years. I've been pregnant and breastfeeding. I'm still breastfeeding. I'm weaning my last baby, and I can really tell the difference this time around. This is my third baby. I'm used to breastfeeding for 2 to 2.5 years each kid. I'm used to getting pretty hollow after breastfeeding. I'm 38 years old, and I'm like, whoa, I don't look so beat up this time around. So I love having this as an option. I think the younger and healthier you start it, the better the outcome with it. Now, if a lot of people will tell me, hey, I don't want to wait for 6 months to see my full result. I'm, noticing my under eye hollowness now. I get that there's a natural option and that sounds really good, but I want to get rid of these hollows right now. So that is where we can go in and do traditional hyaluronic acid filler. Depending on what areas of the face we're treating, we might use hyaluronic acid, we might use a collagen stimulator like Radiesse or Dilute Radiesse or Sculptra. How many sessions do you suggest for doing the natural filler? Minimum of 2. Once you start getting like mid-30s plus, I'll say do a third session, or if you have a lot of hollowness, sunkenness in the area we're treating. So people also like this with weight changes. If they're noticing, changes with weight loss, they'll see in their face. So that's when we can do that collagen stimulation. And you can stack those treatments 1 month apart, and for the first 2, if you want to wait a little bit for your third one, like up to 2 or 3 months, you can, but we want to re-hit that area. It's been at least 6 months since I've done my last one. I would probably do a little bit more under my eyes, maybe into the smile lines. I like this because I think it looks very natural. It doesn't look puffy and overfilled. The downtime is a few days, like 3 to 5 days of it looks a little exaggerated on your swelling, maybe bruised, but the swelling is 3 to 5 days, then it settles. This is very straightforward. Regular filler, I love regular filler too, but it's a little bit more temperamental. You gotta be more mindful of the post-care. Regular filler can fluctuate and swell a little bit longer. It takes longer for it to settle, whereas this is a few days. It's just more so you're waiting for the result. So again, if you want an instant result, that's when we're going to think about doing our regular hyaluronic acid or a calcium-based filler. So with those, we can inject it. There's different types of fillers that we have available to us. I use different ones in different parts of the face on different people, depending on what we're trying to achieve. So if somebody has like really deep hollows or really deep folds, I'm going to use a different product as opposed to somebody that just has, soft folds, nothing too dramatic. So different products, different faces, different parts of the face. With the fillers, you'll be able to see it lift, and then the next few days it's going to swell up, and then it takes about 2 to 3 weeks for that swelling to settle, maybe bruised, and then 6 to 8 weeks for that product to completely integrate, mesh in with the skin where you won't feel it anymore. And then your filler is going to last, I say 1 to 2 years, just depending on your body, your metabolism, what filler we're using, how much we're using. And so we can go the same areas with filler as well as a natural filler, but very commonly people do under eyes, into their cheeks, their temples, smile lines, lips, shadows at the corners of the mouth, their chins, their jawline. So you can go anywhere in the face with it. Really nice. You just want to make sure you're the right candidate for it. So we go through a lot of questions before we decide if you're going to be the right one for this. And then you want to follow your pre and post care. We also say when you're doing filler or any of this stuff, I'm like, do some, let it settle, reassess. You can always do more later. We don't want to rush when we're doing these treatments, or else it will look overfilled. It will look bad. You will lose your shape. You don't want that. So go slow, be mindful, and consider the full face from all the angles. We don't want to just spot treat. When people spot treat, that's when stuff starts to look weird. When I say spot treat, that means like they just do their smile lines. Like you only do your smile lines and then your cheeks are saggy, but you have blown out, no line there. It looks a little off. So we want to think about the full face from all the angles when we're doing your treatments. Okay, let me see. Can lip filler help with lip inversion, lip curling in when you talk? So if your lip curls in when you talk, lip filler is not going to stop that. That is usually a muscle, part of your muscle. So the muscle around the mouth, it's a circle. When somebody smiles and their lip goes like that, curls under, we will use Botox above the upper lip to prevent the muscle from curling in. So then people will feel like they can see the lip forward facing they're like, oh, my lip doesn't go away when I smile and talk anymore. Sometimes they'll tell me, it looks like I got lip filler without getting lip filler. So that's Botox. Now, if you want more volume in your lips, in addition to it not curling in, that's when we'll go in with filler. So some people are doing both. They're doing filler and Botox for their lip, just depending on their goals, depending on the anatomy. When I say the anatomy, it's like the shape of their lip, what's going on, their muscles. So some people are doing both. When you do your lip flip with Botox, it doesn't last a ton of time. I tell people 6 to 8 weeks. I can get it to last longer if we up the dose. People will say it feels a little bit weird to talk or not talk. It feels weird to whistle and to drink from a straw. And as it's kicking in, they're like, oh, it's just like weird because I can feel like I can't go like that anymore. So that is with your Botox. If you do filler, remember your filler is going to last 1-2 years. Actually, I had somebody messaging me the other day. It's been over 2 years. My lips still look so great. So filler can last a long time. That's also why I say go slow. Don't overdo it. Don't rush it when you're doing your filler. Okay, let me see. I saw another. Sorry. I'm going to try to answer all the questions. I just sometimes I go up, so I'm going back down. Okay, what can you do for the neck? So different treatments for our neck depending on your skin concerns. I'll talk through several of them. First and foremost, do your skincare all the way down. Face, neck, chest is really important. Your retinoid is going to help with skin cell turnover, fine lines, texture, pores, all of that. So you want to do your retinoid at night, a few days a week. Use your moisturizer with it. I also love our Jawline Recovery Boost Serum. Love, love, love this one. For hydration of the skin, any skin irritation, acne, inflammation, this is the product to use. That's like our bestseller, always in our office. We use this post-care as well after treatments to help expedite healing of treatments. So do at home your retinoid, your moisturizer, your recovery boost, your sunscreen is going to be the most important thing. So that's your part at home. In the office, if you're trying to improve the texture of the neck, we can also do our skin treatments. We can do aerolase laser, skin pin microneedling, bio-refill, chemical peel. All of those treatments are going to help with collagen stimulation. Also, again, texture, fine lines. So that is dark spots, anything on the neck. So that's going to help with the quality of the neck. Injectable wise, if you have the horizontal necklines and you notice they're getting deeper, people call these tech necklines, we can do filler, a really thin filler into them to soften them. We don't want them all the way gone. Well, we can get them pretty gone. It depends on how deep they are. So we can do filler right into those. People like that. You can see the result right then and there, but because the skin is so thin, I'm like, you will likely bruise. So this is just something you have to be mindful of, making sure, hi, Justice. I hope you're doing so good. Make sure you are, Justice, I told you, softening out those lines with your thin filler. You can also do a collagen stimulator like dilute radius. When we inject that into the neck, again, helping the integrity of the neck, the texture, the firmness of the neck, because that's going to make new collagen gradually. So I have some really good pictures of that. But there's different treatments we can do with the neck non-surgically. Skin tightening devices, I don't really believe in. I've worked with several over the years, and I felt like a lot of patients are like, I don't see any changes, or it did minimal change. And so I don't really think skin tightening devices are doing a lot. You can do Botox in the neck if you have the neck bands that show like this. Some people, when they talk or smile or animate, they have the bands running all the way down. So we can Botox into the neck muscle. That will help tighten along the neck. It can also make the jawline look more defined. If you have a lot of excess skin like hanging around the neck and you really want it tightened, at a certain point, surgery is going to be your best option. So we always say, hey, if you're open to surgery, go do your consult with a surgeon. Get all your questions asked before you decide what treatment you want to do. Just make informed decisions. But we can do a lot non-surgically. Again, I don't really believe in skin tightening devices. You can do Botox to tighten through here. You can do filler for the horizontal lines. You can do your skin treatments, laser, microneedling, chemical peel for the texture, and then your skincare at home and your sunscreen. Very important. Okay, let us see what else we got going on here. Karina had a bad experience with Botox. Tell us about it. What happened? And then Cash said, really bad textured skin on my cheeks and forehead, but really sensitive. Would I be a microneedling candidate? So microneedling, what we're doing with that skin treatment is we're making controlled wounds in the skin. So we numb you up. It's on electronic pin, skin pin microneedling, and there's tiny little punctures going with this pin all over your face. Controlled wounds. When your body senses, oh my gosh, there's a wound, it has to come and repair itself. When it repairs itself, it helps with fine lines, pores, texture, dark spots, collagen stimulation. Acne scars is a big one as well. For textured skin, I think microneedling is really great. Sensitive, let me know what's going on when you say sensitive. Does it just mean you get really reactive? People I would not treat with microneedling if they have active acne, not going to be candidates for doing their skin treatments because we don't want to roll over active acne and spread bacteria on the skin. If they had any like really severe eczema, any like really dry patch on their skin, we wouldn't want to be, in any like skin impairment in that moment, we wouldn't want to treat in that area. But in general, we treat treat all skin types and all skin tones every day with microneedling. In our office, we have a skin membership program. So the patients come in on a monthly basis, and then they have access to our different skin treatments: skin pin microneedling, aerolase laser, bio-refill chemical peel, hydrofacial, facials. Come in, we can pick and choose which treatment is going to be your base treatment for that month. A lot of patients are also combining their base treatment with the other treatment. So they might say, I want to do my microneedling, but I also want to do on the same day my chemical peel and my laser. When we're doing multiple treatments at one time, we're working on different layers in the skin, we're able to get to your results a little bit faster. With all these treatments, we can treat acne, dark spots, fine lines, texture, pores, scarring. Like, we can treat so many things, hydration with these treatments, and patients love them. Everything, again, always safe for black and brown skin, which is really important for all skin types and tones. And then with the laser, the bio-refill, the hydrofacial, no downtime at all. With microneedling, you have a little bit of downtime where you're kind of slightly rosy. You have to keep the skin really clean for like 48 hours. So we just say, like, stay out of the sun, get home, don't put anything on. We have you use the Recovery Boost Serum. This helps expedite the healing. It helps keep the skin hydrated. This is antibacterial, antimicrobial. So patients love this one. But other than that, we're like, don't be putting anything on your skin. We don't want it penetrating deeper than what it's supposed to. Red for like 3 to 5 days, just depending on the person. They'll feel little micro scabs. You can't really see them, but they can kind of feel like little textured. That's normal. We say don't try to pick those off. Let it come off naturally. Within about a week, 5 to 7 days, people are like, oh yeah, I'm back to normal. You can wear makeup after the first 2 days, but those first couple of days we say stay out of the sun. Don't put anything on, use your Recovery Boost Serum, that's it, and no makeup. So patients really like that. I think it stands out for textured skin, for scarring, acne scars, that's like a big one. So patients love that one if they can, do a few days of the downtime. Okay, we talked about for neck tightening. Neck tightening, I don't think there's a lot of non-surgical great devices, so I wouldn't go that way, but you can do Botox into the neck, into here, into the bands to help tighten along the neck. If it's a lot of excess skin, surgery will likely be your best option. Okay, Karina said, had a horrible experience with Botox. Tell us what happened with your Botox. Okay, other than EZ Gel, what do you love for under eyes? I love EZ Gel a lot. So that's the natural filler we talked about earlier, made entirely from your body's growth factors and stem cells. Nothing else is mixed inside of it, made just from you. People love having this as a natural option. I also really like filler, hyaluronic acid filler, in the right candidate. So if you don't want to wait, because remember the natural filler, the EZ Gel, you have to wait for your body to produce new collagen. It happens over time. If you're like, I don't want to wait, my eyes are sunken and I see this and I want to fix it right now, that's when we can go in with traditional hyaluronic acid filler. And there's different fillers that we'll use depending on who I'm treating, how deep the hollow is, how thick their skin is, what the integrity of their skin is. So different ones I'll pick. Now with filler, you're going to see the instant result. It's just you can bruise and swell. You want to make sure you're a candidate for filler. You have to be somebody that doesn't cry a lot, doesn't have bad allergies, doesn't wake up puffy. Anybody that retains a lot of water around their eyes, not good candidates for filler. If you put it under there, it's going to swell up and down. It's going to fluctuate. It's going to look really bad and it lasts a long time. So you don't want to do that. So you just want to make sure you're the right candidate. When we do under eye filler, we break it up into 2 sessions. Do some, let it settle 6 to 8 weeks. We have you reassess the skin after. If it's perfect, cool. We just say leave it. If there's any little spots that we can touch up, we will at that appointment. It's just the skin is so thin under the eyes. I'm like, you're going to bruise and swell. And so I want to be able to see it once it's settled. And then we can determine, how the result is and if we should do any areas. Now, other things to keep in mind when it comes to filler for underneath the eyes. What we can do is camouflage a fat pad underneath the eyes. And we all have fat pads. Some people's protrude out or stick out more than others. So some people look like little eye bags. I can't take away the eye bags non-surgically. Only surgery can pull them out. But we can go underneath the fat pad and behind the fat pad to bring the skin up and then hide it. So everything looks a lot better. And people are like, oh my gosh, you said it wasn't getting rid of my bag, but it did. I'm like, no, it didn't. We just hid it with the filler. It won't change the color of the skin underneath the eyes. A lot of people have either darker skin there or you can see their blood vessels through if their skin is really fair. So I'm like, I can't change the color, but people will tell me after. They're like, you said it wouldn't change the color, but it looks so much brighter under my eyes. I'm like, oh, that was because before you had a shadow from being sunk in. So now we've lifted it light reflects off the face a little bit brighter. They'll also tell me, oh, now actually when I use my concealer works and it looks flat all the way across. Whereas before I'd put concealer and it still looked sunken. It still had a shadow. It wasn't working. So that is under eye filler. I like it. You don't want to rush doing that one. Break it up into 2 sessions. You have to see somebody who does this a lot, because if they're not, they can give you a really bad result and it can look bad for a long time. So we have to use the right filler on the right candidate, the right amount, the right placement, or else it'll look really bad. It looks boggy. It looks like puffy underneath the eye. So that's something we want to be mindful of. I tell people it lasts 1.5 to 2 years. Most people get a lot longer out of it, which is so nice. Okay, let me see. I get hyperpigmentation, and my office said no to microneedling. Rachel, I don't know without seeing you. You look like a black girl that is so beautiful. We do microneedling on black and brown skin all the time, and for hyperpigmentation as well. Biggest things when it comes to hyperpigmentation, especially when it comes to black and brown skin, our biggest thing is going to be first and foremost, avoid the sun, avoid the triggers. So for us, if you get sun on your skin, it's going to make a dark spot. If you have an acne mark, you touch it, it's going to make a dark spot. So our biggest thing is trying to avoid the triggers of the dark spots. Yes, we can treat hyperpigmentation, which is dark spots, on black and brown skin. It is harder to do so because we cannot go crazy aggressive on these settings, on the lasers. There's only certain lasers that are safe for black and brown skin, and lasers and peels and microneedling. There's only certain things that are safe. Not everything is safe for black and brown skin. Now, a white girl, we can burn her skin off and she can have raw skin for 3 days and then her skin glows and 2 days after that. And she won't be burned or hyperpigmented, it'll look great. But black and brown skin, we really like any melanated, olive skin tones, we want to be more mindful of what we're doing. You got to follow the pre and post care. So first and foremost, to help with hyperpigmentation, I tell people all the time, even family members are like, oh, what can I do? My brother-in-law, he's like, I just have these dark marks all over me. I'm like, tell me about your sunscreen. He's like, I don't use sunscreen. I was like, oh, or they'll be like, I put sunscreen on. I'm like, when? They're like, in the morning. I'm like, that's not enough. We got to use our sunscreen. We have to reapply. If we're getting sun on the skin, whether at work we're by windows, whether when we're driving, whatever, if you're getting sun on the skin, it can cause dark marks. It's harder to get rid of them on black and brown skin. Latin, Asian, black and brown girls, Indian, anybody. So I'm like, first and foremost, avoid it. Up your sunscreen use. When they just do that on their own, they already notice things start to look lighter. So that will help. We also can help you with the right products. I love our vitamin C serum for pigment. I use this every day. I love these two. And I also have our sunscreen that I love every day. It's just like in my other bag. So your sunscreen is going to be number 1. Your vitamin C. Those are the things at home. Pigment, you can also do microneedling, aerolase laser, bio-repeal chemical peel. I love the bio-repeal chemical peel for brightening. I think that is, I do all these treatments. I feel like for brightness, the peel was where I see like the biggest effect quickly. So they're both great, but you can stack those on the same day. We just have to, before we do any treatment, we go through a lot of questions with you to be like, are you going to be able to follow the post care? If people are like, I'm not going to wear sunscreen. Oh, I just love being on the beach. I love being in the sun. I'm like, we're not going to do these treatments because doing these can make things worse. So pigment, that's what we want to be mindful of. We can do prescription like hydroquinone, like a fading cream as well, that we can prescribe and dispense to our patients. So we can help you with all of these. We have a Black dermatology nurse practitioner on our team. Her name is Niani. She's excellent and she loves all the skin stuff. I love all the things, period. So our team is very complete and comprehensive, and we give you the support. It's not just when you're in the office too. It's not just when we see you for a treatment. You have access to our team all the time. So I'm like, if you ever have a question, call us, text us. If you're like, I saw this video, what does that mean? Like, if you think that might be pertinent to you, whatever questions you have the support of the team. We want to make sure you're taken care of. Okay, Karina said, do I need a consult with you before we start? So yes, we love to consult with all of our patients before we do any treatments. I like to do a lot of virtual consults. Samantha is one of our other nurse practitioners that does the virtual consults. Any of our team you can see, but we like to do these before you come in. We can go through your questions, goals, tips on what to expect, how to prep for treatments. That way you are set before you even come in. You don't have to do a virtual. We also have in-person consults, but I will say when they do the virtual, they're able to we're starting out the treatment plan at that call. So we're able to start saying, hey, I'm like, show me what you're using. Talk to me about what's upcoming. What are you getting ready for? What have you tried? What hasn't worked? And then I will give my recommendations. What are your concerns? What are you seeing? Oh, you're changing weight. All of these things I'm taking into consideration before we start making recommendations. We make those recommendations. We send you information about everything we discuss. We send you pre-care, post-care, so you know what to do, how to prep before your treatments and what you're going to need to do after. We make sure the timing is right. So if you're like, it's my birthday in 2 months, I'm like, okay, so we have this much time for this and da 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 da. This is how we're going to space your skin treatments. We go through that. If you're like, it's my wedding in 9 months, I need you to be doing this ahead of time, we can start developing that plan. It's not great when people are like, my birthday and my wedding is next week. I'm like, shoot, we can't do too much. We want to be mindful about all these things before we're doing them. We send pricing, we send financing information. So we have everything. The patients are able to review that, and then they can say, I want to make my appointment. Now, you can do in-person appointments as well. I will say, I think the patients do fine there, but it's just harder because they're coming in with from square zero, and they might be like, oh, I didn't know I could bruise. Today is not the day for me to do it. So we want to make sure that your just timing is right. We want to go through everything with you. If you're like, hey, I really want to do this treatment, and we're like, oh, have you been using these retinoids? Have you been using these actives? We're like, oh yeah, I've been using that every day. We're like, oh, we can't start your skin treatments today because your skin is going to be too sensitive for these. So this way, you're just prepared before you come in. Okay, thoughts on RF microneedling? I'm not in love with it. So yeah. Hi, Justice. I hope you're doing so good. Okay, my office recommended chemical pills instead of microneedling. I love pills. I love them. Again, we combine our pill with microneedling all the time and with laser on the same day. How much Botox can you use for a lip flip? We usually start with 6 to 8 units. Depends on the patient. I'll do some people 16 units, but I don't start so aggressive their first time because I don't want it to feel weird for them, again, drinking from the straw or trying to purse their lips. So those are things that we are thinking about. Okay, I'm just trying to scroll back and make sure I didn't miss any. And then I'm going to go to the bottom. Okay. Do you do Jeuveau over original Botox? In our office, we have Botox, Dysport, and Xeomin. In the United States, we have Botox, Dysport, Xeomin, Jeuveau, Ledibobo, Daxify, and there's a new one out. So we have different neurotoxins. This just means different types of Botox. We have 3. I've worked with all of them in the past. I like these 3. And it's up to the patient. A lot of people are like, I can't tell a difference, whichever you like. Or I have this one, the company sent me a coupon from Botox, so use that one. But we have different ones that you can try out. Okay, what's the right way to use hydroquinone on the face? I've seen a lot of bad reviews. So when we do this, we tell patients start once a day. In the area, hydroquinone is going to help fade dark spots. So you only want to treat it on the area of pigmentation. Dark spot only, thin layer of it. You want to moisturize with it. Use your recovery boost serum with it. Use your moisturizer. Stay out of the sun. In the daytime, you have to use your sunscreen. I say start 2 to 3 days a week. Make sure your skin is not too sensitive to it. Then up it once you're okay with it. You have to use this for short term only. So I say 3 months, take a pause. Here and there, I see people say it can go a little bit longer. You don't want to keep using this forever. If you just use it forever, ever on the same spot, it can make the skin get darker. So do it for 3 months, take a break from it, and then you can go back on it. Okay. Sorry. I'm in Atlanta. How do you coordinate between states? So yes, we see patients from all over the world. Every single time I'm in clinic, somebody has flown in with their bags, but we've already done our consult beforehand. So they come in and they already know what's going to go down. So I just don't want people, again, that's another reason why we do the virtuals. I don't want them coming in out of country, out of state, and they're like, oh shoot, I'm not a candidate for this. So we've already talked about it. They've done their part before they come in. They started using certain stuff. They stopped using certain things based on what our treatments are going to be. They're ready. They already know, okay, I got my money ready because I went through the pricing with her. They know all the stuff coming in, and it's not like, oh gosh, I just have no clue what's happening. We do that. Then and because we've already spoken before, we already know, okay, I'm going to need to see you in 2 sessions. We're going to break those sessions up. I'm going to see you 2 months later. You can come anywhere 2 to 3 months later. Once everything settles, and we can fine tune if we want, depending on what treatments we're doing. So we see people from out of state every time I'm in clinic. And so we have 3 offices, 2 in Los Angeles. One is in Mar Vista, so the west side of LA. One is in Torrance, the South Bay, and then in Las Vegas on the Summerlin side. I see patients out of all of them. I was in Vegas on Friday. I go to all the clinics all the time, and I have excellent team members that are there all the time. So if I'm in Vegas, I still have patients, being seen in Torrance and in Mar Vista by our team. The team is amazing, and you will love all of them. Read the reviews on them. Look at their before and afters. The team is excellent. We've worked together for a long time. They understand treating all skin types and all skin tones. They have the same aesthetic outcomes, the same aesthetic preferences. as me. So yeah. Do I treat patients in Vegas? Yes, I was just there. I've been there like every week in February, and then I'll be there next on March 13th. So I think my March 13th, like I added another day. I think March 13th and 25th, my Vegas days get a little bit packed up quick. But you can also see Samantha, our nurse practitioner there, or Anastasia, our advanced licensed esthetician. What sunscreen do you recommend? I don't have it with me right now, but our Jossie brand sunscreen. That is great. My biggest thing and it's a non-white cast sunscreen for black and brown skin, which was really important for me. That is mineral based. Biggest thing for me when you're doing your sunscreen, I'm like, just find one that you like and use it and reapply it. That's the biggest thing. I'm like, if you do nothing, if you're like, I never want to do any of these things, Botox and fillers, like that's ridiculous. Totally don't do it. Like don't do none of it, but do sunscreen. I'm like, at least protect yourself from skin cancer. That's going to be the main thing. If you don't care about aging at all, protect from skin cancer. But also it will help with visible signs of aging, dark spots, fine lines, skin texture. So sunscreen it up. Okay. Let's see. Would you say EZ Gel PRF is a better option for under eye hollowing? I love both of them and filler. I love them both. I have done them both. I'm 38. I did it when I was at 28 years old. I did traditional hyaluronic acid filler. And I liked it, gave me instant result. It took like 6 to 8 weeks to like chill, but I liked it because I was so hollow. Now I haven't done filler again underneath my eyes, but I've been doing the natural filler the past 2 years, the PRF EZ Gel. At first when I did it, I was like, I don't see any change because I'm used to an instant effect from filler. I was like, I don't see anything. It got better over time. So just know that it improves. Overall, I'm very healthy. And so like, I don't smoke, drink, I don't do anything like that. I mean, I do eat a little candy, which is bad, but exercise, like overall healthy lifestyle. And so I've had really wonderful results with it. I love them both. The natural filler is so nice to me because it's like swollen for a few days. Like it looks a little ridiculous for like 3 to 5 days. And then it settles. It is not temperamental. It's not swelling up and down. There's not little bumps like lasting a long time. Again, I love filler, but that is the most temperamental thing, like underneath the eyes with regular filler. You have to be the right candidate for it. You have to understand the limitations. We cannot do too much or it will look bad. The natural filler, I'm like, everybody loves as long as they get that it's not quick. This is not an instant effect. So that's just something to keep in mind. Rachel said, I guess I have to come out with you. I would love to see you. Kay says she loves microneedling as a Black girl, game changer. We love microneedling too. In our office, again, we do skin pin microneedling, Aerolase laser, bio-repill, chemical peel, hydrofacial. A lot of times our patients are combining multiple of those treatments on the same day. So if you wanted to stack it, we would do, okay, you come in, we do your laser first. Right after that, we would do your chemical peel. Right after that, we numb you, and then we do your microneedling. Or you can do your laser first, and then we can do your hydrofacial, followed by the chemical peel. So different stacks, depending on what your concerns are, what your goals are. So thanks so much, Marge, for your love. We use different treatments just depending on what we're trying to target. So I don't want to just be like, everybody do this, even though I think like all these treatments can serve everyone. We still have to go through a lot of questions. We have to understand what's going on with your skin before we make the recommendation for that day. And sometimes I have patients come in and they're like, I'm going to do the chemical peel. But once we start talking, and I'm like, oh, they're like, I'm so dehydrated. My skin, I've been out in Vegas for a long time. Oh my goodness. I'm like, oh, the chemical peel, if you're already like really dehydrated and feeling irritated, I don't want to do this. The best thing for you is going to be your hydrofacial. So this is why we go through so many questions. We consult every single time you come in, every time. Even for people I've seen my entire 13 years as a provider, when they come in, I'm not just like, oh, we're going to do your Botox again. No, I have to ask them so many questions. I'm like, hey, how was last time? Should we adjust anything? Has anything changed going on? Give me feedback. We want to hear from you so then we can make the right treatment plan for you based on what's going on in life. So there's a lot of things that we're considering before we start poking. And I think so many people think it's just like, oh, it's just Botox, it's just lip filler. It's not. It's not just that. There's like so much that goes with it in our decision making, in the clinical decision making. Okay, let me see. What are your thoughts on Midface filler? I love it. We just want to do the right product and the right patient. So Midface filler, that's through here. What we're trying to achieve usually. So as we get older, we start to lose fat in our face. Fat pads start to separate. They start to sink. We also are losing bone in certain spots. So very commonly as we age, people will notice, do I have a pencil here? I do. these fat pads will start to separate. Let's see if this will work. Sometimes I like to draw. So they'll notice like a line from their under eye that kind of cuts through their cheek. They'll notice a smile line getting deeper. They'll notice the corner of the mouth getting deeper. And then they'll notice over time, this fat pad keeps coming down. Their jowl looks saggy. Their jawline looks saggy, this little jowl fat pad. We also start to lose bone right through here. So their chin start to sit back. It looks a little bit more dimply. And then we lose volume in through our temples as well. So this looks more hollow. So this is very common with aging. You will see this even quicker with weight changes. So what we're doing with filler or the natural fillers, we're trying to restore volume. As an injector, me and my team, we're thinking about what's going on underneath the skin. I'm not just here to like plump up, oh, this line right here. I'm thinking, okay, where are we losing bone? Where are fat pads separating? That is how we make our patients look the most natural and look like them. So oftentimes we're doing filler into this line here, but also I'm looking at if they have volume loss in this lateral part of their orbital rim. So this is the eye bone behind that fat pad. So if this looks sunken, I'll put some there. And I don't want to just only feel right here and then all of a sudden they have most of their highlight is all here, they're cheeky. Sometimes I will put a little bit lateral to create the highlight on the cheek without making the cheekbone built up and like looking too angular, because that can look a little off. We really want to be mindful of who we're treating and the face and what's going on. We want it to look true to you, not something weird. But small bits there can make the highlight look up and make the face look pulled up. And so without doing surgery. Filler into the temple or collagen stimulator into the temple is going to give some volume here. It's going to help the cheek look pulled back. It's also going to put some highlight behind the eyebrow so the eyebrow looks lifted. It's not actually pulling you back, but all of these things are about creating how light hits off the face, creating an illusion of a lift. I don't really chase smile lines unless somebody's really bothered by a smile line. To me, I'm like, you don't want to get the line all the way gone. If you try to get the line all the way gone, your face is going to look pudgy and overdone. You don't want that. It just depends on the face. So I'm like, we want to have a little bit of shadow, but I know from understanding what's happening beneath the skin, pull the skin back, what's going on is we start losing bone right here. So this gets really sunken on people, and this will be the deepest part of the smile line for most people. So I will put a collagen stimulator or filler right there. This is going to make the smile line look softer and this not have a shadow next to the nose. Okay, this is a line that I do like to treat on people. Marionette lines. As we get older, our lips start to get a little thinner and then they start to curve downwards and then they get this line right here. It looks like old lady sad lips. And they're like, people think I look mad and sad, and I'm not even mad and sad, but what is going on right here? So when we put some filler or a collagen stimulator or the natural filler into here, it's going to soften that shadow, put some support so the lips don't look so downturned. I also like to do this even in people in their like late 20s, early 30s. It's not a line, but we start to see that shadow there. Okay, then sometimes I will do filler. Remember I talked to you about this fat pad keeps coming down. It makes the jowl look right here, like looks saggy on the jawline. So sometimes I'm trying to hide that and I'll put filler in front of, possibly behind that fat pad. And I don't want the face to just look bulky and wide right here. So I might also put a little bit of filler into the chin to create a highlight here. These are the things, like this is just different things we can do on the face depending on who we're treating, what's going on, how their face is aging. We will likely see aging accelerated with weight changes. So if they're like, I lost a bunch of weight, then I'm like, oh, you're probably going to see these same areas, but just faster. Like people will be like, oh my gosh, I lost weight and now my face looks flat. Everything looks down. I don't look happy. It looks like everything's going down. Nothing is lifted. So this is what we're thinking about, the full face. We're not just thinking about, oh my gosh, the smile line is there. We're thinking about like what is contributing to that smile line getting deeper. That's volume loss through here, the temples. We're thinking about the whole thing. Now, when you look at our patient before and after photos, you can do that at the top of my page. When you see them, they look very natural. They look like themselves. If you just looked after photos, you wouldn't think, oh my gosh, that person has a bunch of skin treatments and Botox and filler. You wouldn't think that. They just look fresh. That's the whole point that we're trying to do here. They look like themselves. Now, when you see the before, you're like, oh, dang, I can see the change. Like they just look brighter. They look lifted, but it looks like them. We're not trying to morph all the faces into the same face. That is very important to us. We see all skin types and tones. I don't need everybody looking like one face. I'm like, it needs to look like you. So this is what we're considering. We also talk about, your goals. If you don't know what you like, or if you don't know what the changes are that you're seeing on the face, I'm like, it's okay. I can tell you what I see, but also what's helpful is show us a picture. I'm like, show me a picture of you whenever you felt the most beautiful. So that could be a few years ago. That could be prior to the weight change. That could be an altered or filtered photo. I'm like, show me. when I see some photos of you, I can start telling you, okay, look where the highlight hits here. Or if I see how you always angle your photos, I'm like, what you're trying to do is create this sort of light off the face, and I can explain it. So that's what we do with our injectables. Okay, let me see. But I love Midface filler in the right patient, the right product. I will mention this. So remember, there's different type of fillers available on the market, and not all injectors know how to use all the different types. The thing is, these fillers have different properties. Some are thicker, some are thinner. We need to use the right product in the right face. What I treat on a 30-year-old Black girl is going to be different than when I treat a 65-year-old white woman. Very likely because Black girl that's young is going to have a lot of fat in her face, different bone structure. A white woman that is older, likely not as much fat in the face. So I need different products. If I use the same thing, it could look too aggressive on like an older person with not much fat, and it could look like they didn't do anything on somebody that has fullness. So for us, we really just understand these products and how they work. I will say the companies don't always teach on all the different faces. And when they do the clinical trials, they're not always doing it in, they do it in all the skin tones. However, the number that they treat in is way less. When it comes to Black and brown skin, it's like a minority is that they treat in these clinical trials. So then they launch the product. They teach, injectors on how to use it, but they're primarily thinking about one demographic. For us, just we could see everybody. I'm like, I know how these products work in different faces. I know how to get the dang result. Like, look at the patient before and after. It's like, read our reviews. It's not like, take my word for it. It's like, look at the patient. The patients come and make their own videos about their experiences, not me telling them to do so. Like, they can show you what they look like. And I always say thank you to our patients for sharing. So many of them have consented photos. We have thousands of photos that are just consented from people like, hey, I want other people to be able to see themselves in this, because I never saw a Black girl, an Indian girl, an Asian girl, somebody that looked like me getting these treatments done until I came across your page. But I'm like, yeah, that's because my patients have allowed us. So thank you. Sorry, I've been talking too long. Okay. Let me go down. It says 30 minutes. I'm trying to go. Chanel, I would love to see you. She wants to come see me. How to send a photo. So you can set up virtual consults. You can set up your virtual consult at the top of my page through there, or you can call or text the team. They can help you with setting a virtual consult. You can send pictures there, but just looking at the picture is not going to be able to give me the recommendation. So I can look at a photo and I can say what I would think, but I have to hear from you and your concerns and your goals and what's going on. So you can also do a video. Some people will send a video, and then I'll make a video response to them. They'll do, 2-minute thing and say, hey, I'm this person and this is what's going on. This is my face. These are my concerns. This is when I started seeing them. Kind of tell me what's going on, and then I can make recommendations like that. Majority of our patients are doing the virtual consult or an in-person consult, so we can talk through everything. Because even if I make a 2 to 5 minute response video back to you, I likely have a lot of follow-up questions. We text them to you, but it's not the same as having this rapport. Okay. Elena said, freeze me, looking like me. I know, I want to be frozen too. Okay, I don't want to look morphed. Marge said that, and that's our patients. They don't. If you look at their pictures, they don't. They just love it. They just feel like themselves. And I say, tell me, what are your friends and family saying? They're like, nobody knew. They couldn't say what I did, but they're like, did you change your hair? Did you change your makeup? Did you go on a vacation? They don't know what happened. That's the whole point. They're like, oh, I got carded when I went out. It's little things that they keep hearing. I'm like, that's the point. People know something, but they can't tell what it is because, again, we're thinking beneath the skin, how the face is changing, and we're thinking about the full face. You didn't see me just draw this line right here and say, oh, we get rid of smile lines. No, I talked to you about the whole thing, what was going on. Bone loss here, volume loss here, fat pad separating here, trying to hide this fat pad laterally, trying to create a little highlight up here, losing bone here, so focus there. If you want minimal filler through the smile line, remember, the lips get thinner, this turns down. I'm thinking about the full thing, not just oh, you want your lips? And that's where people will mess up. They just do one spot. They just oh my gosh, my lips look small, but not realizing their whole face has changed. Oh, I'm 50 and now my lips look like they've withered away. It wasn't just your lips, but also the support here and here and here. If you don't hit those areas up, it can look weird because now you got a nice juicy set of lips, but with corners like that on your mouth and your chin is set back, it looks bad. So I tell people, we want to think about the full thing. And how I'm talking here, explaining it is what we do in person. I'm saying, hey, this is where I'm seeing the changes on your face. This is where I'm going to tell there was a patient I just saw in Vegas the other day. Beautiful. She had a fuller face naturally. She had changed weight. And she was like noticing the smile lines. I was like, okay, we can soften, not try to get them gone. She had a lot of like heaviness here. I was like, I could probably get her jawline pretty straight. But I told her, I was like, my hesitation on you is I don't want to like widen your lower face or you're going to just look like a lot of face. You know, I can make that jawline sharp from the side, but from the front, it's going to look really boxy. Like we don't want that. So we Botoxed here. We did a little into her chin. We did the corners. We got to think about her in that moment and what's going on. And I'll tell you what's going on, like in my mind when we approach your care and why I'm thinking, yes, this and no, let's hold on that. Or like, let's let this settle and reassess because I want it to look good every single time. I know I'm so extra. Pop-ups, I know. Okay. I know I hear this a lot from people. I've been working on getting my license in other states. I got my license in Florida. I've got my license in Texas. Texas is a big one. Texas and New York, we see so many people from there in Florida. So God willing. But there's still like, I always have to follow that state's rules and licensures and like the medical director. There's just like stuff that comes with it. It's not just like popping up. Guys, everything I do, I'm like not here to play around with your face. Anything I do has got to be like the right way. I went to Stanford. I went to Duke. Like this, I got to do things the right way when I'm doing all of them. But I will tell you, I will let you know if/when I expand or get to other ones. Brenda, I want to get under eye filler. I think you'll like it when we do under eye filler. So we talked about hiding that fat pad from, the medial part, like inside, as well as the lateral part. We also don't want to just have puffed up under eyes and a saggy cheek. So I'm looking at the mid face as well. Not everybody's doing it. If you already have good volume in your mid face, but it's just the under eyes that are sunken. So we just have to look at the full thing. But I do think under eye filler is great if you're a candidate. You don't get puffy, you don't cry a lot, don't have bad allergies, you don't retain a lot of water around your eyes. If you are somebody that's not a candidate for it, you can consider the PRF EZ Gel, the natural filler. Okay. Let me see. I'm trying to see what the prices are before I book a consult. Where can I see them? So you can see them at our website, Jasi, Jasi, JasiSkin.com. And we have all the pricing on there. We try to make it very like straightforward so you can see it. And I'm not trying to like hide the pricing. Obviously, when you come in for a consult, I can give you a better recommendation, but we have pricing for like, hey, if you're thinking about these areas, this is what it is. Here's what our skin treatments are. So everything is there. I want it to be very straightforward for you, transparent, so you can understand. Also, you're going to be able to get the best pricing from after we just do our consults. But all this stuff is there because I know a lot of people are like, we can't give you anything. I like try to give you general ranges depending on the areas of the face that you're thinking about on the website that you can see and for the skin treatments. How much does that cost? Mary Chris. I don't know if you were talking about when I was drawing out on the face. So when I was talking about all these different areas on the face, depending on if we're doing natural filler or traditional filler, I would say when we're thinking about the full face, people are doing usually like anywhere 4,000 to 6,000. It can be more or less depending on how they present, how old they are, what their goals are. But it just depends on what they're doing. So usually think like, 2,000 to 3,000 for mid face, 2,000 to 3,000 for the lower face. That's about 2 to 3 syringes per area. If somebody came in, they're like, I lost 100 pounds, we might be doing more, just depending on what their baseline is and what their goals are. And then we obviously are doing our skin treatments. We have our skin membership. You come in on a monthly basis. It is $3.99 to do either the skin pin microneedling, aerolase laser, biorepill chemical peel, or the hydrofacial. Do that as your base treatment. If you want to stack, so remember, most of our patients are stacking. They're doing the laser, the peel, the microneedling, all in one time. When we're doing that, it's $250 if you want to stack on another treatment. And then you can do your face, neck, chest. If you want to do the neck and chest, it's a $250 add-on. So again, trying to make it really transparent on there. All the pricing is on our online. Okay, I've been following your posts. Absolutely love it. I live in the East Coast. We see people from there all the time, like all the time. I have and they're even on membership and they come monthly. So it just depends. My biggest thing, I know we can't see everybody, but we see people from all over the world. We treat patients, black and brown skin. We treat everybody, all skin types, all skin tones. We are very comprehensive. We're going to get you natural looking results. Big focus on skin health. I don't want to just have your face looking completely, no lines and it's lifted, but the skin is bad. If the skin looks bad, that's the first thing everyone sees. So we want to make sure your skin looks right. So we're very big on skin treatments. Everything we do, safe for black and brown skin. We do virtual consults before you come in. We start building out your treatment plan. We send you all the info to prep before you come in so you're ready for it. But we cannot see every patient all the time. I have a lot of people international and they're like, sometimes like, I just can't, like somebody's messaged me now, she's from Ghana and she's like, I want to do my consult, but like, I don't know when I can come in. We cannot see everybody all the time. I totally get it. My biggest thing, if you're trying to find a provider, I'm like, do your research on them. Go and do a consult, ask a lot of questions, make sure you look at their patient before and after photos, read their reviews, make sure they're licensed. That's a basic one, but people will do some crazy things with their face. Licensed to perform the treatments they're doing. That's the biggest thing, is like, don't rush it. People mess up when they're rushing, when they're just like, I got to do this. I got to do it quick. I saw this thing online and my lips look sad and I just need to do something now. I'm like, that's not the move. Like, because people will take advantage of you. People will mess your face up and then not even respond to you and you looking crazy. And it can take a lot more money to try to fix it and do it the right way than if you just did it right the first time. So definitely take your time when you're trying to find who you're going to trust to touch your face, whether it's skin treatments, whether it's injectables. All of this stuff means a lot. When it comes to the skin treatments, not everybody knows how to work with black and brown skin. Not every treatment is safe for black and brown skin. A lot of people, and they might even not even trying to do something ill, like they're not even trying to do it out of ill intent. However, they just don't know what to do. So if you go and like, nobody knows and nobody's ever treating anyone that looks like you gotta be careful. You can end up burned, long-term scarring. Oh gosh, like mental is not, who even cares about the cost, which is going to be a lot to try to fix it, but the mental load to take that on is going to be really rough. So research who you're trusting. You guys say this all the time. Okay. Soft Life said, I want to get my nose done. Okay, let's talk about what we can do without surgery for the nose. So without surgery, we can camouflage a bump on the nose. We can lift a tip on the nose. We can create a highlight down the center. We can work on the nostrils, on the shaping. So some people have it more round or triangle. They want them to look more, symmetrical. We can minimize asymmetries of the nose. We can do Botox to help nasal flaring. So the nostrils don't look wide like that when they're talking and smiling. Can do Botox, oh gosh, I need it, into the bunny lines on the nose. All of these things can help make the nose appear thinner. A lot of people want their nose to look a little smaller, or can just camouflage a bump. We can do these things. You can see the results right then and there when it comes to your filler. It cannot, like if your nose is really wide and you want it really pinched in, I'm like, only surgery is going to do that. The things that we're trying to do, we're trying to like create an illusion of it looking thinner by enhancing this highlight, by minimizing the appearance of that bump. And I have a lot of good patient before and after photos on nose filler, different skin types and tones. You can go see that on males and females at the top of my page. So you can go see that in the nose filler series, and you can see patients that, what it looks like with nose filler without surgery. So I tell people it lasts 1.5 to 2 years. A lot of people get longer out of it. It is a very nice treatment. You can get your results really instantly. So that's nice. Okay. I went to an esthetician and she said I couldn't get under eye filler. What makes someone eligible? So we talked about that. Anybody that gets puffy under their eyes, not good candidates. You can consider the natural filler PRF EZ Gel. If you are sunken, hollow, loss of volume, those are people that we're trying to use filler or the natural filler on. If you just have big protruding eye bags, the fat pads, remember we all have fat pads, just some people stick forward more than others. If yours are really big, the only way to get them away is surgery. They can take it out or tighten it. If they're not, we can hide them. I also have some pictures of this on people with filler, and you can see I've done some really good results of like hiding the fat pads. But I tell the patients, like, if you want it gone, only surgery is going to take it away. Okay. Okay, I think I got those. Okay, smile lines treatments. So for smile lines, we can use filler or a natural filler, a collagen stimulator to soften them. We're not trying to get the smile lines all the way gone. If you do that, it can look puffy on your face. Remember, it's not just us chasing the smile line right here. What is contributing to that line getting deeper? Have you lost volume in through the mid-face? If so, we're going to consider these other areas as well, not just chase one area of the face. I love doing these treatments. Okay, let me see. 18 messages. Let's see. Okay, hi. Best treatments for smokers' lines. So if you have these lines above the lip right here, when you talk or smile, that's where we can use Botox to prevent the lip from pursing. A lot of people, if they do this a lot, that's what the smokers would do, like that. They notice they start getting the lines. Also with age, we just lose collagen, and so there's not as much support there. So they start seeing the lines. I remember I had a seamstress one time. She's like, I'm not a smoker, but I always hold the needle in my, so she had a lot of the lines. So Botox will minimize you from making that face. So the lip will not crease those lines. You can also do really, 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 really thin filler to soften the lines, or you can use your collagen stimulator like the PRF EZ Gel. You don't want to do too much filler into those or it'll look puffy. I know you guys have seen it where people have these puffy above the border lips. You don't want that. So you can soften the line. And then at home, using your retinoid is going to help with fine lines, pores, texture, dark spots. Use your retinoid and then use your moisturizer with that. And then your skin treatments. Microneedling would be really great for that with the peel and the laser. So those are the treatments you can do for your the smoker's lines. Marge says she lost volume underneath her eyes. So yeah, if you're sunken under your eyes, that's where it's filler. Maybe they thought you get puffy under your eyes, or you cry a lot, or you have bad allergies. So that's where they would say you're not a candidate for it. So you can consider the natural one. Okay. Why they want to have all this done in their face, especially women of color, they want to be European. Why are so many people trying to change their ethnic noses? I don't understand. So it's really for people to feel however is going to make them feel the best and feel their best self and feel beautiful. And I get it. It's not for everyone, but there's a lot of people that are like, hey, I do these things and I feel more confident. I can go forward in the world and just feel better about myself. So I say, it's like, how you pick what clothes you wear, and if you wear deodorant, and how you style your hair, and what car you wear, if you put makeup on. It's like, don't worry about what other people think about. For you what matters, and that's what to do. So and people think this is like, oh my gosh, this is just, they want lip filler and they just want a nose pump. It's not just that. Sometimes you don't even know. I remember treating a patient and I did her nose, and she told me, she's like, I look at my nose every single day. And I've had multiple patients with this. Goodness gracious. I looked at my nose every single day. I was assaulted. I was beat up. I had trauma. Every time I see that, I'm reminded by it. And so you straightened it out, and I don't have to think about it every day. So you don't know people's stories on what brings them forward to get these treatments. And it's really not our place to judge how people feel about it. We are not the beholders of beauty. I'm like, that person needs to think about for them. Even if it's something I don't always agree with, I'm like, hey, let's talk it through. It's not my way or the highway, but let's maybe hold this. Let's talk through why I'm thinking pause. Like, let's think it through. The biggest thing is like, it's for that person. You just don't always know what is going on. I had one patient come in. She brought her daughter. She's like, my daughter gets bullied every day. Even she was 17. She's like, even her school altered her nose in her volleyball photo. She's like, the girl cries every day about her nose. She's like, I'm not going to do nerve surgery. I don't treat minors, and I'm not trying to promote doing that. But in that instance, with what was going on, and I've treated that entire family, she's like, we're never going to tell anybody this, but that's what was going on. So you don't understand, what people are going through and what drives them to get these treatments and how they feel. I hear the stories every day, which is why it is so impactful to me. Like, I'm like, oh, thank you for sharing. You don't know. I have people, they're like, I lost my job, or I'm going to re-enter the workforce, and I look the oldest, and I need to not look the oldest, or I'm not getting picked. You don't know what's going on in people's lives and what drives them to do it. I get to hear a lot of these things, and it's very special to hear it. When they're just like, I'm not suffering. I feel better about myself. I can go about life and not feel sad. That's a big thing. It's very impactful. So it's all for the person. Are in Vegas? Yes, I'm in Los Angeles and Las Vegas. I reside in Los Angeles. I see patients in all three of our clinics. So we've got Mar Vista, Torrance, and then Las Vegas on the Summerlin side. I just got radius. Can I still get Sculptra? Yes, but not. You got to wait for that to settle. Give that a few 2-3 months. I love your work. I need sculpting with Botox like you do. Thank you so much. I really love what I do. So I'm Ginille, a cosmetic nurse practitioner. I've been doing this since 2013. This is all I do. This is not a side job. Like, this is all I do. All I focus on, what I have studied. I went to Stanford. I went to Duke. I say that so you can know I'm not playing around with like anything I do. Everything I do, I put my whole heart into it. This is only God's plan for me to do this. I never was seeking to do aesthetics at all. Somebody gave me this job that I didn't really want at all. I was like, what is this? And then when they told me it was like this Botox thing, I was like, that weird thing where people look crazy on TV. I didn't even know what it was. I was like, for celebs, like, this is weird. And I went and I started hearing from regular, everyday people why they get these treatments. And I was like, whoa. And it became very powerful to me. I was like, oh, hearing their stories and seeing how it made them feel is what made me get into it. And then everything I do, I just go 5 bajillion, infinity, million% at it, which is very important because I'm dealing with people's faces. It means a lot to me. And like, I know people are trusting me and they're like coming in there and they're nervous and all that. So I'm like, I need to freaking deliver every freaking time. on these results, and it's only led by Jesus Christ. So I'm grateful. I love what I do. I have long-term relationships. I'm like, we're with our people forever, forever. If you look at these girls, they've become 6, 7, 10, my whole time, 13 years. I'm very grateful. But again, it's not just like, oh, I know you, so I'm just going to do the same old thing on you. It's us talking about what's going on in life. If I've seen you for 13 years, you have aged 13 years. What's going on? Oh, you've also gone through hormonal changes. How has that impacted the face? We talk through all of this stuff. I've been with people through divorces and marriages and all kinds of things. That's like so many things. And I'm just grateful to like be a part of their journey and hear their stories and to help them feel good wherever they're at. Okay. How do I find a good injector in my area? I'm in Dallas. I've done Botox, but very basic. So yes, research your provider, consult, look at their before and afters, make sure they're treating people who look like you, ask them a lot of questions, like have an active voice in your treatment plan. So this is why I tell people, I'm like, you're not just coming here and I'm not just, they're just like, what should I do? I'm like, I got to ask you like 50 questions before I can say what you should do, because what you should do depends on like what your concerns are and what's going on. So we really have to hear from you. It should not just be somebody coming in and poking at you and telling you this, and this. You need to explain what you're seeing, what's going on, what your hesitations are, any of that stuff. All of that needs to be answered before you allow someone to touch your face with it, whether it's a skin treatment or injectables, any of it. So it's very important. Okay. I wear contacts. Does that affect under eye filler or PRF? No, as long as you're not pressing on the area is very important, like right after you do it. So, but you're fine. So, okay, let's go to Florida. I know, and because I'm in Florida all the time because I take my kids there for trips. But I know I have my license there. The Florida licensing thing was easy. It is the medical director. They have so many like things on the medical director there, and I had a medical director. He's like, I'm ready to go, but like. It's just weird. It's just weird every time. So that is one that I was thinking prior to Vegas, but the Vegas is easy from the LA, so we can get right there. I will let you guys know for sure. Any places. Justice, you're so real, using your face as a model. Thank you. Thank you. Can we do a mock consultation now? Yes. If you want to add yourself on here, we can do it. We can talk through it. Letitia, hi, Ginille. I love your lives. I hope you're doing so good. Yes, we can do mock. I used to do those a lot. And something messed up when I started doing my lives and I don't know how to do a split screen. So yeah. Okay, let me see. Back down, 18 messages. Best treatment for eyelid wrinkles, please. Okay, so I think you mean underneath. So if when you smile, you got these little lines underneath here, that's where people will notice. You can see I have like little ones there. That's where we can do your skin treatment at home. Your retinoid with your recovery boost and your moisturizer. That's going to be the first part. Your skin treatments, your microneedling, and your bio-repill chemical peel can go all the way up. Laser, it's going to be a little too close to the eye, but your microneedling go all the way up. That'll help with the fine lines and the texture. You can do very, very small amounts of Botox. You can't do a lot. And that'll help stop you from wrinkling up like that. You see how my eyes crunching? Remember, guys, I don't have Botox. I'm breastfeeding. So you can do a little bit there, but if you do too much Botox, it's going to pull you down. So you can do just a little bit underneath. If those look deeper because you're hollow or sunken, we can do the natural filler or regular filler. So those are different considerations. Now, sometimes people still are like, I have this. I'm like, I can't get it all the way gone. If I try to get it all the way, I could, but I don't want it to look weird. I don't want it to look puffed up or pulled down. So we want to be mindful of all the considerations before we're just doing the treatments. Okay. Let's see. No, I mean the actual lid. Okay. Up here. Ooh, you got to be careful with that. Be careful there. Retinoid, your moisturizer. If your person can pull back your skin and do your microneedling up there, as long as they can get it on bone, you can do. You don't want to do it like on your eyeball. So those are some considerations. If it's like heavy lid, then you can do Botox to lift, or you can do surgery. Okay, let's see. Do you do any skin consults outside of your state? Yes, all the time. We do it all the time. Even some people cannot come in for treatments, but they need the right skin regimen. If we have the license in that state, we can prescribe and dispense for prescriptions, and then also get them started using our Jawline, giving recommendations there based on their skin concerns. So yeah. When do you suggest a full face of Botox? And we can talk about where Botox goes in the face. I say like when it concerns you. So some people will tell me like, hey, these lines don't bother me. And I'm like, if they don't bother you, I don't need to like do anything about them. So it's really like, if it's bothersome to you, if you're trying to be preventative, usually late 20s, early 30s are where people will start to notice the lines start to stay like mine, a little etched in. It's been a while since I've done it. Remember, I'm breastfeeding that baby that needs to be weaned. So you want to get them before they get really etched in on the skin. When they're deeply etched and you're not even like moving or making a face and they're just like deep lines, it's hard to take those away. We might not even be able to. So common places we can do Botox: into the frown lines, into the horizontal forehead lines, around the eyes, our crow's feet, bunny lines right here, nostrils you can do. You can do it for a gummy smile. If when you smile, your gum raises, your lip raises up and you show your gums. You can do that to minimize the appearance there. Remember, we can do it above the upper lip. If you have the smoker's lines or you're trying to prevent the lip from curling in when you smile, you can do it right here at the, like where these little marionette lines are. If you always make sad face and you're trying to prevent that pulling down of the corners into the chin, I like this one a lot for dimpling, oh gosh, of the chin. So you can soften that out. Botox into the neck muscle is going to help these bands look tighter and the jawline look more defined. Botox into the masseters and or temporalis for TMJ pain, headaches, clenching, teeth grinding, jaw pain. So those are all things that you can do with Botox cosmetically, as well as therapeutically for your pain, your migraines. We also do Botox into the neck, into the traps. If somebody feels like they're always like holding a lot of tension there, we'll do Botox there. Botox into the palm of the hands, underneath the arms, into the soles of feet for excessive sweating. Very common. I've also done it in the groin for excessive sweating. Botox into the calves if you have really bulky calves and you're trying to slim. So we can go a lot of places with Botox. We just talk about all the things, but not all those areas concern everybody. So not, some people are like, my lip doesn't curl in when I smile, or I don't make the sad face. I don't do that. So I'm like, okay, don't do those areas. Some people are like, their brows are already high and I say smile and they don't have any lines there. So I'm like, don't do that. So it really just depends on your face, what's going on, how you animate. Some people, they are super expressive. I mean, I make a lot of faces because I'm doing this all the time for training. Also, my kids, they're little. So I'm trying to oh, yeah, hey, baby, show them all the loves and all that. So some people make a lot of faces and they're like, I don't like these lines. I need to tone them down. Some people make a lot of faces, but they tell me I'm a comedian. I'm an actress. So I'm like, oh, shoot, you probably need to have some frown lines. Like, we don't want to take it all the way away. So all of those questions are like what I have to go through, my team has to go through before we decide how to Botox you, where to Botox you, how much to put. Everybody's dose is different. I know I'll come on here and I'll talk about, hey, 20 units here, 20 there. Those are guidelines, but it just depends on the face. If I have somebody with a really big forehead, a quadruple head, they're going to do more. Sometimes I have people and their hairline is like right there and they have a tiny forehead. They're going to do less. Some people I say frown and they're like, I'm frowning and I can't even see them flexing. They're going to do less. Some people I say frown, they're like big bulky muscles. I'm like, oh shoot, they're going to do more. So this is why it's all customized to your face based on like what's going on when we look at you and talk to you about your goals. Because it's not just me looking at you. It's also, again, what are you doing for work? I remember I had the guys, they'll be like, what should I do? Men, they never know. I'm like, hey, some men told me straight up, freeze me. Gay men, they're like, I don't have no lines at all. Freeze me up. I'm like, okay. I have other men like, no, I always play the bad cop. If you're always the bad cop, then like, I'm not going to take your frown lines away. So those are all the things that we're thinking about before we start just poking you. There's so many questions. Okay, how would you raise someone's brow that are hard? How would you raise someone's brow that is hard to raise? We can do Botox at the tail end of the brow, the crow's feet right there. So you can see this muscle when I close in, scrunches in like that. So when we Botox here, it's going to help. It's not like, woo, it's not like that, but it's going to give some lift around the tail end of the brow. Some people that have like more, gosh dang, mine need some. People that close in more, they're going to see a little bit more of it, of more of a lift. Also, you want to be mindful, don't do too much Botox in the forehead. The forehead muscle is used to lift our brow. So if you Botox it, it's going to do the opposite thing. We don't want it to push down and feel heavy. So we would do less on your forehead. So those are things that we consider. Would it need, do you think if the beauty standard wasn't so high, all these young people wouldn't need these procedures? It's so sad to see society again, I'm like, this is, you were talking to me about this earlier. This is for people to feel great. And I tell people all the time, you don't need any of this. You are beautiful without it. Okay. God loves you without it, period. Straight up. You don't need it. Now, if you want to do this, we're going to make it look great, make it look like you, make it look natural, hear your voice in this, make sure you're safe. That's the most important. Seen, heard, beautiful. Those are what I'm thinking about when we do it. So Yeah, people, it's society, and people look at the phones, and people make more money if they look more beautiful and they feel more confident. So I don't know what to say. Like, that's just is what it is. It's not for everybody. Some people want, thank you so much for your loves. Some people say, I don't care about my lines. I want all the lines. I'm like, I love you for that. I love you, period. Like, you don't need any of this. People know that. My patients know that all the time. I'm like, you don't need any of it. If they're coming in and it's really like a mental thing that they're going through, I'm like, hey, girl, I've definitely told people no. If they're just crying, I'm like, well, what's going on? They're like, well, I just got broken up and I just want to like prove to the guy. I'm like, hold on. Let's talk this through. Should we do this now or should we wait? Are you like in the right mental state? So there's a lot of considerations that at least I'm taking and my team take before we do these treatments. We're not here to just do a money grab. That's not it. So people are going to do the treatments no matter what. It just is what it is. They're going to do these things. Before Botox and filler, they were doing all kinds of beauty treatments dated back to the Bible. So people want to look and feel good. It is what it is. But are we going to do them safe? We're going to make sure you feel safe, seen, heard, beautiful? Yes. Am I going to make sure that I consider all skin types and tones? Yes. That's what I do. I'm going to get you natural looking results? Yes. That's what I do. So that's it. Okay. Volufine for hollowing under eyes. I don't know what that is. And if it's approved for FDA use in the United States. So I have sometimes a lot of people from outside of the country. I don't know all the products. Okay, what tox do you recommend? I've been using Dysport. It doesn't seem like it lasts. I like Botox, Dysport, Xeomin. I like Dysport on myself when I do it, but it just depends on you. I'm like, just try and see if another one works for you. There's also Leti Bobo. That's a new one. Sometimes when people have used Botox a long time, they get a little, like their body gets used to it. Like they've built up resistant to it. So they can use a different one. Myoblock is a new one for that. So there's different ones that you can consider. Okay. Let's see. Is it really about changing your ethnicity or just about tweaking things to your liking? Yeah, Allie, that's what I'm saying. Okay. Brows. What's the best retinoid? Our Jossie retinoid, I love. If you've never used a new retinol, start with a Jossie one. This has some buffer in it, so it's not so caustic, so hard, aggressive on the skin. If you've been like, I've been using retinol forever, I can do it every day, my skin totally tolerates it, use tretinoin, Retin-A. And so we prescribe and dispense that in the office. We also have our Jossie line. I think I linked just these two because I had these like next to me when I started this, but I love our products and they're what I use, the only things I use on my face. Okay. Do you joint venture with other business owners? No, I do not right now. So I never intended to make this whole thing. I've been doing this since 2013. In 2021, I had my second of 3 babies. I was also fostering twins at that time. And so I was like, I need to work less and be home more and be present with the kids, or like see my patients and then come home and be present. And so I went and I started my own thing to just see patients on the times that I could show up for work. And it just grew. And then I had nurses asking me to work with me. And I was like, no, I'm just doing my thing. Like, I'm just trying to see these patients and go on home. And then I really liked these other nurses. And I was like, oh, you can extend what I'm doing. And like, you have the same aesthetic, like outlook on this treatments and doing all of this. Like, you're a good person. You're not just trying to shove things down people's faces. And so then we like slowly started bringing on just the right providers. Oh, the team. If you guys have been to the office, everybody loves the whole team. They're so excellent. And I'm so thankful and like proud to work alongside them. And so, yeah, now we have 3 offices and like excellent providers that I fully trust and our patients trust with their faces, and they get amazing results. So yeah. Okay, let me go back down. Sorry. Some of these questions were like probably from 5 or 10 minutes ago, and I'm just talking and I'm trying to scroll back and get to them. Maybe I should go this way. Can Botox slim a wide nose? Yes, it can. So if we do Botox along the nostrils, if your nostrils flare a lot, you can do Botox there to help slim. Also doing some of the filler that we were talking about earlier, trying to enhance the highlight, can help create a wide nose look a little bit thinner. But it's not, if your nose is really wide, surgery is going to be the best option. Okay. Okay. My brows get heavy with Botox in the forehead. Why? So if you naturally, some people have really a lot of strong lines on their forehead, and that is because they're using their forehead muscle to lift their brows. Sometimes because if their vision is not so good or their brows are a little bit lower, they're always like constantly lifting like that. Botox is going to do the opposite effect. So instead of lifting, it's going to push down. So I think for you, it's either go less on your dose. It's either skip it all the way. I'm doing the horizontal lines. Go less on the dose, and then your provider has to inject a little bit higher. The closer they get injecting to your brows, the more likely it's to feel heavy like that. Another consideration is do your crow's feet, do right here to lift at the tail end. And then they got to do the medial part as well to help lift. Those areas here and here are going to help counterbalance heaviness on the forehead. Okay, what's your career path to become a cosmetic nurse? I just completed prerequisites. So I went into nursing to do family medicine, which I did for like 5 seconds. I like it too, but this is just where God needed me to be. After nursing, so there's different pathways to get into nursing, and it depends on what state you're in, who is allowed to perform cosmetic procedures. So I'm in California. In Vegas, you have to be licensed as a registered nurse practitioner, PA. So I did nursing school. I went directly into nurse practitioner school while I was working simultaneously as a registered nurse. After that, somebody gave this job to me, and I was like, I don't even know what that is. I don't want to do that job. And then I really liked it after just talking to the patients and seeing it was like regular people who just wanted to feel their best selves, and it wasn't something so crazy like I was thinking in my mind, this preconceived notion that Botox is going to be like this and everybody that did it was just stuck up and they only cared about how they look. It wasn't that. I was like, this is regular people. This is really cool. After that, like, it's you going to be investing in this. So I was going to trainings. And if I didn't have a patient, because I was a new injector, I was watching every injector in my office. I was shadowing them in the rooms. I was talking to the patients about their experience. I was asking them just so much, trying to absorb everything, talking to reps about the products, really trying to understand the products. I would take pictures of all my patients before and afters. I'd go home and look at my before and afters. I'd be like, how could I have done that better? If I saw something I could have done better, I'd call the patient up. Hey, can you come back so I can do this better? All of these things played a role. And I've just been doing it for a very long time. I've been doing it for 13 years. Not everybody is like that. Not everybody just gets handed it. I understand that. That's why I'm like, this is only God's plan. I didn't know what this was. I have trained people from zero, and they are excellent and fully booked. And I've even helped people start from zero and they have their own clinics and are fully booked. It is just like, are you going to be about it, basically? Like, are you going to study? You're going to put the work in? A lot of people say they want to do it, but I'm like, people don't want to really do it. It takes a lot because you have to freaking get excellent results on the patient's face. And if you don't, they're not going to come back. So it just takes a lot. I've studied this. Anything I do, like I said, I put my whole heart into it. I just love it. I can talk about this and do this all day. I can see patients all day, all night. If I didn't have these babies, God made me have babies and a husband. So I have to stop. But otherwise, I could do this all day. I can talk about it. I love it. I want people to make safe decisions. I want them making informed decisions. So it just depends. And if you are trying to get into it, like asking to shadow, we take on interns and nurses and help them shadow and stuff. But I got to take on somebody that's going to be about it. We help them to learn. But if they're coming in and they're kind of disrespecting the patient time, I'm like, I don't have time for that. So they just got to be excellent. Ask people to shadow, but if you're going to go there, be 100%. That's the thing. Don't take up the patient's time. I had some young girl, a patient asked me, somebody before, can my daughter shadow you? She wants to do this. The girl was chewing Cheetos all day. I was like, oh my gosh, in the patient chair. I'm like, stop. I don't have time for it. So those are some things. Okay. I've never done any facial treatments. I'm 40 years old. Noticing wrinkles on my forehead. Recommendations. So at home, your retinoid. I love our Jossie retinoid, or you can do tretinoin. Your moisturizer, your recovery boost to help with so the retinoid is not so irritating. This, I should put it on right now. I really love this one. This helps with any skin irritation, redness, itchiness, inflammation in the skin, hydration of the skin, helps calm down the skin after skin treatments. Let me see if I can open it. I just love the color. I use this on my kids if they have open wounds and cuts, and this will help expedite all of your healing after your, it's a pretty color, after your skin treatments. Okay, so that's your skincare at home. And then you got to be doing your sunscreen straight up. Okay, then in the office, we can do skin pen microneedling, aerolase laser, bio-repeal chemical peel. That's my favorite. I want to do it. My husband was trying to do one today. Or hydrofacial. So those are going to work on skin texture and the foundation. Who cares if you have lines if your skin looks bad? So right skincare at home, skin treatments, you know, got to keep the health of the skin. It's very important. Then you can do Botox in through the upper face. You want to make sure, remember I was talking earlier about somebody that said they get heavy from Botox. So your person has to assess you, you know, do you have to treat here, these other areas as well? So you don't feel heavy, but you're doing some Botox is going to help soften those lines out. Those are going to be some nice places to start. Other treatments to start, if you've never done anything and you're in your 40s, aside from doing your skincare at home, aside from doing your skin treatments, skin pin microneedling, aerolase laser, bio-repeal chemical peel, Botox, love it. You want to do your, I love the PRF EZ Gel, so the natural filler. So that's the one we draw blood from your arm, spin it in the centrifuge. It separates out your growth factors and stem cells. We take that, we heat it and cool it, and we make a gel out of it. Nothing else is mixed inside of it, but wherever we place it, your body's going to make new collagen over time, gradually. So under eyes, remember all these spots earlier we were drawing out earlier. Remember, people start noticing fat pads separating. They're going to get this line from the under eyes that splits down through their cheek. Smile lines are going to get deeper. The deepest part is going to be here. Corners of the mouth look deeper. All of this is what's happening beneath the skin. This fat pad keeps coming down. This jawline looks saggy. The jowls are showing. So we're trying to do some camouflaging of that jawline, of that jowl fat pad. So all of those things like that is going to help new collagen in these areas where we're going to keep losing volume and things are going to keep looking sunken and deeper. So I like that as a natural way. I love filler too. Filler will give you an instant result. But for your body to produce new collagen gradually, it looks very, very natural. It doesn't look overdone. I've never seen it look overfilled. It's made entirely from you. A lot of people, if they've never done anything, they're like, oh, I kind of like that because I can like ease my way into it. You can always go in with filler in the same areas if you want later. If you're like, actually, I want to see the result now. And I started the collagen process, but I don't want to wait 4 months or 6 months to see the results. I want the instant result. Then you can go in with filler in those same spots if you like, or you can start with filler. And some people maintain with the natural filler. But I think that is nice considering where we're losing volume. I forgot to talk about the temples too. Okay. Let's see. Any recommendation? Let's see. Okay, I think I got this. What Botox is used to get rid of double chin? My son is 2 now. Oh, my son is 2 and my baby we're afraid of that baby. He's wild. He's so sweet. And then he's so sour. And then I've got 2 more boys. So you can do Botox into the neck bands. So that's going to help. Remember these muscles? These are here, and we have these Platysmal muscles. So when you Botox it, it's going to make the neck just look a little bit more swan neck, elongated, tighten along the jawline. If you have fat cells, and you can also do under here. A lot of people, when I do Botox, are like, you got rid of my double chin. They're like, do that thing again. Like, whatever you did last time, do that again, but do more. They always want to like do more into the neck. So that's a really nice treatment. It's not neck surgery. If you have a lot of excess skin, surgery is going to be the best option. But if you have a lot of fullness underneath and it's not just, you know, you're like, hey, the Botox is not doing enough, we can consider Kybella. It's a permanent fat dissolver. Kybella, I use it. It's like not my favorite thing, but it does work. It just takes a while to get to the point, like multiple vials, multiple treatments, where I tell people, I'm like, if you're open to surgery, go see the surgeon and let them suck that out real quick. So those are different options for underneath the chin and looking like fullness underneath there. Okay, let's see. I'm trying to make sure I didn't miss any. I think I got these. Okay, 19 new messages. Let's go. I got a filler appointment March 6th. I'm so excited for you. Okay, what can I do for dark circles? So if it's just you're not hollow at all, you don't have any sunkenness or volume loss, I don't know anything to change the color of the skin. I've tried different things. If I ever wear makeup, I'll put on concealer here, but you can see my skin is darker there naturally. It used to look worse. If you look at my photos, like one of the first pinned videos on my thing, it was really more dark because it was sunken. And so when I lifted it with filler and when I've lifted it with the natural filler, light reflects off the face a little bit brighter. But if you're like already lifted, you don't have any volume loss, then I don't know anything to change the color there. You know, people will say, prescribe me the bleaching cream. I'm like, okay, I will, but I don't have high hopes for this. Usually they're like, I didn't really see too much change. I'm like, yeah, you can do brightening treatments like your bio-repeal chemical peel, use your vitamin C, use your retinoid, but I still don't think it like changes the color where it's like, oh, now it's the same color as my cheek. So yeah. How many PRF EZ Gel sessions are needed? You want to do at least 2. If you're mid-30s or plus, or you've had a lot of volume loss, do 3. Spread those a month apart. Maybe if you want to wait a little bit from your second to third one, you can wait anywhere from like 2 to 3 months and then let it set. Do your maintenance around a year. Okay. Let me see. What school did I go to for nurse practitioner? I went to Duke for my bachelor's in science of nursing and my master's in science of nursing. I'm a family nurse practitioner. And I went to Stanford for my undergrad. I did human biology and comparative studies in race and ethnicity there. And I met my husband there. Okay, please tell us about PRP treatments. Do they actually work, and how much does that run? So in our office, we do PRF EZ Gel, the natural filler. We were talking about that a few minutes ago. Draw your blood, spin it down, separates out your platelet-rich fibrin and your platelet-rich plasma. We take that, your growth factors and stem cells. We don't just take that and inject it. A lot of people just take that and inject it. We heat it and cool it, and so then it forms into a gel. When it forms into a gel, one, you're going to get a little bit more of a like instant lift. It's kind of cute. But more so, it's because remember that lift is not going to really stay. More so, when we heat and cool it, your body is going to hold on to those growth factors and stem cells for up to 3 months. Whereas when you don't heat it and cool it, it's only a few weeks, 3 days to 3 weeks. And so when the body's holding on to those growth factors and stem cells, they have longer exposure underneath the skin. Your body can make that collagen, has more chances of making collagen underneath. In our office, the 2 sessions are $2,550. If you're a member in our skin membership program, it's $950 a session. So, and then if you add a third session on after you do your $2,550 within 3 months, it's $950. I have some people that will do their full faces with this. Some people at 40s, I've had people all ages. They're like, I never want to do filler, or I'm not a candidate for filler, whatever their reason. Like, I never want to do filler. And they will do this. I've done it their full face. Under eyes, temples, cheeks, smile lines, jawline, corners of the mouth, lips, like everywhere. I've done it my full face the past couple of years. I don't think I would have believed in it had I not been in this position where I could only do the natural one. Remember, I'm breastfeeding this baby. That's big. I'm like, I see it and I don't feel so beat up this time. And I like it, and it doesn't look weird. It doesn't look done. People look like themselves. It just looks fresh. It's very natural looking. Now, if you want something more dramatic, you're like, I want these cheeks to be like Snatch or my jawline really angular, then I might need to use filler depending on what you're naturally starting with. I got to look at your face before I can make that recommendation. So, bonjour. I hope you're doing so great. Okay. Is Botox preventative or is it a quick fix? I hear all the time it's not preventative. It is. So if you start doing Botox before these lines get etched in on the skin, they're never going to get etched in. So I remember when I was younger, in my younger days, and I would see people that I always thought they were like 10 years younger than what they were. I was like, oh, hi, you look so good. And they're like, I've been doing Botox for a long time, small bits of Botox for a long time, and kept their skin right. That was the best thing. Like if their skin looks healthy. When I would see people and they would say they're 40, but they look 50, usually their skin look really aged. So they had a lot of dark spots, fine lines. That makes the skin, that just makes the people look older, and they had those lines etched on the skin. So I think it's great not being like, oh my gosh, I'm not saying every person has to start Botox when they're 20. I'm not. Sometimes I have these girls come, I'm like, what are you doing? Like, you're a baby. We can wait. Now, you can do smaller doses. It just depends on your face and what's going on. So you can do smaller doses, but I say before they get deeply etched on the skin to do it. Once they're deeply etched, sometimes I've had patients come in and I've made videos about this and I have examples to show. But when they're like, hey, I've been making these faces for my whole life, 45 years old, and even when they're not frowning or making any face and they're looking at me and I see these etched lines just deep and deep, I'm like, dang, once it's already etched on the skin, Botox is not going to just magically take them all the way away. It can soften them. It can prevent them from getting worse. But if they're like deep on the skin, I can't get them all the way away. So just a thing. So I never went to aesthetic school. I'm in Atlanta. I start BS in Chamberlain in March. There's not a school for aesthetics. So it is like trainings and trainings and trainings. But yeah, I have taken like certifications to be, I took this extra test to be, a certified nurse, aesthetic nurse. But like even that is not required. I'm just extra and I want to do all the extra things and learn all the stuff I can, but there's not a school for aesthetics. Thoughts on Xeomin? Our patients like it, especially if they've never done anything. They like that one. Anybody that tells me they get heavy on their forehead, the Xeomin I hear in general, it just feels lighter. So that's when I'll kind of grab that one. Should I do Botox for my nose? I don't like it, how it flares when I smile. Yes. So into the nostrils, that will help. Okay. Let me see. What Botox is, we talked about that one. Okay, I think I got these. I think I got it. Is it hard for you to blink? Like if you have Botox there? No, you'll be fine. Okay, what do you use to repair your skin barrier? Oh my goodness, guys, this one I keep talking about. The Recovery Boost Serum is excellent. for skin. We use this on open wounds, like right after microneedling. This helps expedite your healing. This is great for skin barrier protection. If my kids have cuts, this goes on it. If any sort of like skin inflammation, acne, dryness, like this is what we use. And then you seal it in with the moisturizer. I don't have it here in front of me, but I have it in my bathroom over there. Seal it in with the moisturizer for extra hydration of the skin. So this is our number one thing. My patients are like, this, it's green, but it's called liquid gold is what they say. So I try to tell them, I'm like, if you want to see if this works or not, just treat one side of your face with it and come back and tell me. And they can never, like, I did that for half a day and I couldn't do it. They're like, the other side needed it. So this product is great for skin barrier. Use this with your retinoids, use this with your skin treatments, use this, period. So yeah. Okay. For smile lines and lifting the cheeks, would you say Botox is needed or fillers? So that is where you're going to be using your filler. So your filler will soften these lines. Think of filler as like hydrating, plumping, lifting. Botox is going to stop the muscles from flexing. But for the cheeks and smile lines, that's going to be your filler or the natural filler. Okay, I think I got it. It's my freaking smile lines. Okay. Thank you. I got to feel okay. I think I got it. She need to come see you. I would love to see you. Okay, I think I got the questions. If you guys have other ones, let me know. I, again, will let you know just about myself. I'm Ginille, cosmetic nurse practitioner. I've been doing this since 2013. Face is what I focus on. I do body stuff too, but like I specialize in face. We have an entire team of providers, not just me. We have, like I said, Black dermatology nurse practitioner. We have Claire on here. She's a big creator here. She loves skin stuff. She's one of our nurses. We have amazing, amazing providers on our team. Come see the team in the offices. We are in Los Angeles and Las Vegas. I've got Mar Vista, Torrance, and then we're on the Summerlin side of Vegas. We love to do virtual consults with you before you come in so we can go through your questions, your goals, tips on what to expect, how to prep for treatments. We're really big on patient education, making sure you understand what we're doing and why we're doing it or why we're saying hold on something. All of these things are very important in guiding us and making sure we're doing the right treatments for you. We build out these treatment plans, all the stuff. Ask us all the questions. You are very clued in. You know what's going on and why it's going on. Everything we do, safe for all skin types and all skin tones. I have to say that. I'm Filipino and Black, but also not everything in aesthetics is made for Black and brown skin. So it's really important. Look at our patient before and afters, read our reviews. They speak for themselves. Like it is what it is. And we focus on natural looking aesthetic results. So we see people from all over the world. I'm so grateful to do this. I love this. I'm like, this is God's blessing and talent for me. Let me see. I got a few more questions and then I will head off, but I come on here pretty frequently and I try to also have it with my team if I can catch them in between patients so that you guys can see other team members as well. Is Sculptra better than filler? This is just, they're different. So Sculptra is a collagen stimulator, similar to your natural filler, your PRF EZ Gel, but PRF EZ Gel is made from you. Sculptra is not made from you, but wherever we place it, think about it as a fertilizer, a collagen stimulator. Collagen is going to keep things looking youthful, plump, lifted. We start losing collagen mid-20s, so this is a nice way to replace it. You cannot put Sculptra under the eyes, into the nose, into the lips, but very commonly people like it for their temples and through their mid-face, into this, if we don't want the cheeks too bulky and then underneath looking sucked in, I like to do it there. So Sculptra is a nice injectable, nice alternative to filler. They're just different. So like I was on a campaign a few years ago where I did for the company that makes Sculptra, and I did patient like for their before and afters for the company. We did like filler from their product line, so like rest and lift in through the cheeks, and then Sculptra into the mid face, into the temples. So these things, you remember, there's different products for different parts of the face, depending on what we're trying to achieve. We got to look at your face. We got to talk about your goals and then make that decision. You can bring a twin sister in and have completely different treatment plans. So much thought goes into developing these plans specific to you and your face and what's going on. Okay. Is there any procedures that would prevent or hinder me from getting a facelift in the future? I know I saw people like surgeons talking about Sculptra not stopping them, making it harder for a facelift. I heard that chatter like a year or two ago, and they have since stopped chattering about that. All these people have been doing so many people have been doing non-surgical treatments before they even get surgery and they're fine, but I'm not a surgeon, so I don't want to talk out of place. Just ask your surgeon before you do that. I have not heard anything about your fillers, about your natural filler, about your Botox. Like, I'm working in LA, like Beverly Hills, and working alongside plastic surgeons. They do surgery on these patients that are getting these treatments all the time. Okay, I want to get filler, but I'm in Sacramento. I want to support a Black business, but I can't find one near me. You got to keep searching. I'm from Sacramento. I'm from Elk Grove. But yeah, keep searching. Do your research on your provider. That's the biggest thing. Do your consults. Look at their reviews. That's the biggest stuff. Look at their patient before and afters. You just research. Don't rush the treatments. I see people from Northern California all the time. I see people from all over the world all the time. So if you're ever in LA or Vegas, let us know. If I want both PRP EZ Gel and filler for instant look, which should I get first and what spacing? So it depends on how much something is bothering you. If you're like, shoot, I look hollow and I look sunken and I keep looking at this every day and I don't want to wait 6 months, start with your filler first and then maintain with your natural filler. So if you did filler first, do your filler. I would wait 2-3 months before you put natural filler on top. Other people will jumpstart for the collagen stimulation, and then they come in with filler later down the line. So you can do both, but not in the same time, in the same space. Okay, let me see. I think, can horizontal necklines, tech neck, be realistic reverse, or is it more of preventing it? Definitely try to prevent it. Prevention's always the best, but you can use, remember, your retinoid, and use your recovery boost with the retinoid, your moisturizer to help because the skin on the neck is a little bit thinner. And so we just want to be more cautious with being too aggressive on our skin care there. Then do your skin treatments, your microneedling, your bio-repelled chemical peel, your aerolase laser, do all your skin treatments all the way down. And then you can do really thin filler into the lines to soften them. Yeah. And I haven't gotten them really smooth on people. If they're deep, it gets hard to try to take them away. But like mine, I mean, I haven't done mine, but I would do mine. Patients really like that treatment. So yeah, but if you can prevent it, that's the best. But I feel like a lot of us are looking down all the time. And so we're like etching those lines in. Okay, let's see. I think I got these. I think I got all the questions. Okay, I'm going to go run, see my babies. If you have other questions, call or text us, the number at the top of my page. I see all those messages that come in. You can DM, but sometimes I don't always get those so fast. I also, the messages that come through, I have a whole team. And so they're responding to those. If I'm in with patients, they're getting those, but I see everyone that comes in. We can set up virtual consult time. We can do that at the top of my page as well, or you can call or text the team. They can help you with that. Pricing is on our website, jossyskin.com. All the stuff is there. Look at the patient before and after. Is like, we're here. Don't make rush decisions. We're here to make informed decisions. We're with our patients forever. We build out treatment plans. Ask us all the questions. Like anything on my head that is pertinent to you and your treatment, I will tell you. You guys see, I talk too long and I can talk all day because I love it. I'm very, very excited. It's really fun to me and impactful for the patient and impactful for me because I get to see how they feel. So yeah. If you have anything, please let me know. Thank you so much for